Afterburn Warriors. Today we are going to tackle our outer hip and our outer thigh with our foam roller. So we need a mat and a foam roller. What we're going to do is we are going to start right on the side of our body. So we're going to find the top lip of our hip, and what we're going to do is rest right on our side. You'll find a little pocket in your hip bone that the foam roller will sit right on. So we're going to brace with our hand or elbow. We're going to stretch out our bottom leg and lay directly on our side, one hip on top of the other, and let that foam roller sit right in the little pocket of our hip. So we're going to review our general rules for our foam rolling. We always want short, controlled, pressurized rolls. So we want about 8 to 10 back and forth, short, pressurized rolls. So this is where we're seeking out any tension in that muscle area. So right now we are on our TFL, or tensor fascia latae, which is connected to our IT band. So if any of you experience IT pain, tension, sciatica as well, low back pain, or even knee pain, it can be connected to your outer hip. So after we do our 8 to 10 rolls on our TFL, if we experience a little bit of tenderness, we're going to pause and we are going to grind back and forth on the roller. So just wiggling back and forth, massaging that muscle in. Now, if we want to add some movement here for our TFL, we are going to brace with our top leg, and we are going to slowly lift and lower our bottom leg, which just helps move, contract, and release those muscle fibers to help us dig in. So once we get our TFL done, we are going to take our foam roller and bring it down just past the other little protrusion in our hip, so that we are down on the beginning of our outer thigh. Okay, so using our top foot to help drive us, we are going to do our 8 to 10 rolls. So we're sectioning off our outer thigh, starting up just at the top with our 8 to 10 pressurized rolls. So if you feel a little tension here, we're going to pause. We are going to wiggle back and forth, okay, smushing that muscle in. Try to get lots of pressure. Now, if we ever get on this area, the outer thighs can be really, really tight and really tense sometimes. So if it's too intense down here on the floor, we're going to take the foam roller against the wall on the same area. Now that we've done our rock back and forth, we're going to do our movement. We're going to lift and lower the leg about 5 or 6 times. And then moving to the next section. So slowly working our way down our leg. Only move down about 2 to 3 inches and keep the roll about the same length, about 2 to 3 inches. So now we're getting down towards the meat of your outer thigh, and this is where it can get pretty intense sometimes. So keep listening to your body, take breaks if you need to, and again, take it to the wall if we have to relieve the pressure. After our 8 to 10 rolls, we're going to rock, really trying to release that tension and lessen the pain. You can also try, if the rocking is too hard, just sitting on it. So just letting yourself try to relax. So our body, when it's tight, wants to pull away. We want to pull away and fight it. And when we pull away, our body will tense. When our muscles tense, it's harder to release. So if the rolling and rocking is too much, we are just going to let our body rest. Focus on your breath and will your body to relax. Will that muscle to let go. Once you feel it kind of give or soften, then we can move on to the next section. With our outer thigh, we can keep moving down the thigh until we get right on the outer part of the side of the knee. Okay? So just listening to our body as we go, and of course once we do one side, we are going to tackle the other. Most times our body is unbalanced, so you might find one side a little harder, a little more hurtful, and the other side not as bad. So there are our outer hip and our outer thigh. Enjoy!